Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Alfuzosin. Its brand name is Xatral. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So Alfuzosin exhibits selective antagonism at postsynaptic alpha-1 adrenoreceptors. This action has the ability to cause relaxation of smooth muscle in the bladder neck and prostate. This results in improved urine flow and a decrease in symptoms associated with benign prostatic hyperplasia, or BPH. In terms of indications for use, alfuzosin is indicated to be used in the treatment of lower urinary tract symptoms associated with benign prostatic hyperplasia. Now, before somebody was to use alfuzosin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to alfuzosin or to any other component of the formulation, they would not be able to use this medication. And this medication should also not be used with potent CYP3A4 inhibitors such as ketoconazole, as this may result in an increase in alfuzosin blood levels. And lastly, for contraindications, this medication should not be used in individuals who have moderate to severe hepatic or liver impairment. Now, in terms of precautions, patients should be made aware that this medication may cause orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, and this may sometimes result in syncope or fainting. There's a risk of new or worsening angina pectoris or chest pain, and if this was to occur, the medication may have to be stopped. Caution would have to be used in patients using this medication who have pre-existing prolonged QT interval or who are using other medications that also may cause a prolonged QT interval. It's not recommended to use this medication with alpha blockers. And caution would have to be exercised in patients who have severe renal impairment or a creatinine clearance less than 30 milliliters per minute. And lastly, patients should also be made aware that priapism may occur with the use of this medication and should be treated immediately if it was to occur. Now, once somebody has cleared the contraindications and is made aware of the precautions and warnings, and they start to use alfuzosin, they can expect to receive their dose orally. So if somebody is using alfuzosin to treat lower urinary tract symptoms associated with BPH, they would typically use 10 milligrams once daily with food and typically with the same meal each day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using alfuzosin, so I'll go over some of those here now. About 6% of patients may experience dizziness, and 3% may experience a headache. 3% may experience an upper respiratory infection, and about 2.5% may experience fatigue. Now, some more rare but serious side effects, both happening less than 1% of the time, would be the orthostatic hypotension that we discussed, as well as syncope. And we also mentioned that this medication may cause priapism. That's all we're going to talk about today with alfuzosin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.